Well, the big news at the World Stroke Conference was the Nerinetide data, which was a nitric oxide inhibitor. There was a lot of hope for that study, and it turned out to not be positive. Um, and even when given, and there was a possible signal that when the drug was given in the ambulance very early, that maybe there was a benefit, but the study was confounded by interpretation was confounded by the fact that there was imbalance between the groups and it was small numbers. So the question is still out on Nerinetide, but essentially what we have found is that all cytoprotective drugs so far tested, as you well know and everybody knows, have not yet been positive. And so, and we have to remember that at least in animal models and in tissue culture, these many of the events that have been targeted by neuroprotective drugs or cytoprotective drugs occur so quickly, instantaneously after the onset of stroke, that the idea that you can interrupt them with therapy after the stroke is, to me, seems like it's going to continue to be a futile endeavor, and that the more productive approach would be to target the more downstream effects like inflammation and stuff like that. And glensosamab, although initially posited as something to amplify thrombolysis, which it may still do, may have an effect on some of those downstream effects. Having said that, again, I'm getting long-winded, but we have tried, other anti-inflammatory strategies, things that block free radical scavengers and things like that, that target downstream effects, and they haven't been successful either. So, the search continues. I think there are a lot of ideas out there. I think that in my mind, the only thing that we've shown clearly works is getting the artery open. So to me, I think the most exciting research in the field are with drugs that are aimed at improving reperfusion and not so much at cytoprotection. But having said that, we have to keep our minds open, and maybe there's a better cytoprotective drug out there. There is this SPAN network, which Dr. Leiden is leading, which is a multi-centered approach to trying to find an optimal cytoprotective drug. The first round identified uric acid, and there have been studies with uric acid that have shown promise. I just don't know what the status is of further studies of uric acid. And I do know that the SPAN network, I think, is going to do a second round looking for another round of possible cytoprotective agents.